Over to the right here, orthodiagnosis. We want to know, for example, whether they're class 1 occlusal and skeletal or 2 or 3. And this is important. So if the laboratory calls you and they're looking at the way they're articulating a case for a crown or a bridge, and the patient is in class 3, they might think that we got a wrong bite or something. So you can refer back to this if the lab ever calls you to make sure that the class 3 occlusion that they have mounted is accurate. So if you look at your hard tissue chart, white sheet, you can see that, oh yeah, they have class 3 skeletal and occlusal. So they are going to make this bridge in a class 3 relationship. Severe crowding. We're doing a lot of the new Candid Pro, which is really nice. It's the aligner therapy that the orthodontist uses AI technology to help with the movement of the teeth. And there's a camera attached to the case so that the patient can use that with their cell phone, and their smartphone will transfer that information to us as well as the specialist to determine whether or not they're actually using their aligners 20 plus hours a day, and if their teeth are moving like they should be moving. So that's important to make sure that we know whether they have issues with crowding. Then we're going to go over to the this box right here. This is done by my assistant typically. They're going to ask these questions: last cleaning, how many times they brush, if they floss, how often they floss, if they're doing coffee or tea, if they smoke or chew, do they have dry mouth, and are they using hard candies, and are they using cough drops? A lot of times when I used to say, are you chewing any hard candies because you got a lot of decay cervically? And they're like, no candies at all. I don't do any of that. But then I find out later that they don't think cough drops are candy. So I like to put cough drops down there because a lot of times people with dry mouth from the medication from their heart or their high blood pressure causes them to have dry mouth, so they end up doing cough drops, which they think is okay because it's medicine and not candy, but cough drops are all sugar. The next thing I like to do is give a periodiagnosis. We want to know what their periodiagnosis is. So just measure like maybe 4 or 5 different teeth and do an average pocket depth, and then give a periodiagnosis right here. So we want to make sure we know what their periodiagnosis is. So are they, early, moderate, severe, or are they healthy? And then what would the recommended treatment be? Is it root planing and scaling for quads? Is it going to be a gross debridement? Or is it just going to be just a basic adult prophy? And then what their recall series is going to be. This is really helpful for the hygienist because now you've seen the patient for a limited exam, and now you know how to schedule them appropriately with the hygienist so they don't have to do this again and waste time for them on their schedule. If they know they need root planing and scaling, they're going to schedule the adequate amount of time to do that. Underneath there too is bleeding and probing, which is 0, low, moderate, severe, and also sub and sup calc. So are they, above and below the gum line calculus, 0, low, moderate, severe, and then stain. This also is going to help determine how much time the hygienist is going to need. So we're not only helping ourselves building our schedule by doing this hard tissue chart, but we're also helping the hygienist so they're not wasting their time. Then we want to check the temporomandibular joint, right? We want to make sure everyone today is grinding and clenching their teeth. I think 90% of the population does it at one time or another. So we want to find out what kind of issues they have with their temporomandibular joint. Do they have popping, crepitus? Are they having pain on opening or closing? Do they currently have occlusal guard? And if so, how old? Are they getting frequent headaches? Do you notice clenching or grinding? Is there any wear or notching like the gum line called abfractions? That's really indicative. A lot of times I'll just tell the patient, hey, it looks like you're grinding your teeth. Are you doing it during the day or at night? Because a lot of times if you ask the patient, are they grinding or clenching their teeth, they're going to